Hello, I'm Richard Kennedy. I'm the Executive Director of the Tennessee Commission on Children and Youth. We are incredibly pleased to be the Annie E. Casey Foundation's Kids Count partner in the state of Tennessee. This year is the 30th anniversary of the National Kids Count book. The Annie E. Casey Foundation every year will look at 4 indicators of child well-being in the states across the country, and will rank those states with each other and compared to each other. This year, Tennessee has dropped 1 spot from number 35 to number 36. Although changes in the different indicators were by and large minimal, the most significant indicator change had to do with teen and child deaths, where Tennessee saw a significant decrease in that rank, primarily due to increased homicide and suicide rates with our children and youth. We are very thankful in Tennessee that Governor Lee and his administration are prioritizing mental health and substance abuse services and increasing partnership with the Tennessee Suicide Prevention Network. But this indicator really does show that we need to place even more emphasis and continue to prioritize those services, ranging from more access to mental health services to increased mental health services in schools and communities across the state. One of the important things to consider in thinking about the health indicator for Tennessee is that for Casey purposes, they look at children that are age 1 through the age of 18. So what's not captured in that data is the infant mortality rate in Tennessee. And we know that minority children are twice as likely to die as non-minority children in those first months of their lives. So we need to continue to pay attention to and prioritize strategies that would help address that, whether it's neonatal care, whether it's evidence-based home visiting programs, all of the multitude of strategies that we can look at to reduce that disparity. One of the other indicators that is looked at and highlighted in the Kids Count book is economic well-being. Tennessee improved in this category. We moved from the spot of 33rd to the spot of 32nd. And although we had this gain, we know that 1 in 4 children in Tennessee still live in poverty. So we have to continue to prioritize those opportunities and strategies that improve incomes for all Tennesseans. One of the key recommendations to be highlighted in this year's Kids Count report is the need to do everything possible and utilize all strategies possible to ensure that we accurately count all 1.5 million children in Tennessee in the 2020 census. We know that Tennessee is incredibly reliant on federal dollars. Through the resource mapping project work that's done at the Commission on Children and Youth, we know that once you back out the funding for the basic education plan, 7 out of every $10 spent on a child in Tennessee is a federal dollar. In thinking about the health indicator, one of the things that we need to continue to do is to think about expanding Medicaid or developing strategies to do that. What we know is that children whose parents have health care insurance and coverage are more likely to have health care insurance and coverage for their children. So the benefits of expanding Medicaid in Tennessee would have far-reaching benefits for all Tennesseans. In looking at the education domain, Tennessee moved up. We moved from 35th to 33rd. The basis for this improvement are continued improvements in 3rd grade reading and 8th grade math scores. Although this improvement is something to be very proud of, we still have great opportunity because one of the lowest ranking areas that we have in education are the number of 3- and 4-year-olds who are enrolled in quality pre-K programs. So one of the things that we need to continue to work on is access to those high-quality pre-K early education opportunities in the state. In looking at the health indicator, one of the things that we need to continue to consider in Tennessee is expanding Medicaid or developing a state-specific plan to take advantage of those dollars. What we know through research is that children whose parents are covered by insurance are more likely to be covered by insurance themselves, and their parents are more likely to go to their doctors for visits and as well as their children. Expanding Medicaid would also prevent more closures of rural hospitals across the the state. We know that expanding Medicaid will also prevent further rural hospital closures. We also know that Tennessee ranks second for hospital closures, ranks second to Texas. We know that the rural hospital closures will further restrict access to quality health care that's close and convenient for folks that live in the rural areas of the state. As previously mentioned in the health indicator, the reason that we dropped was because of the increase in homicide and suicide in children and teens. And we know that with those homicides and suicides, more than 60% of them involved a firearm. One of the things that we know is that we have an opportunity to develop strategies to look at laws to really ensure that guns are stored safely so that no child or young person has access to that and can commit suicide or homicide.